Let's discuss today the most important parameters of CBC, complete blood count. These both tests or the parameters are most important for your good health. Let's understand both of these one by one. Now let's discuss what is RBC. A red blood cell count measures the number of red blood cells, also known as erythrocytes, in your blood. Red blood cells carry oxygen from your lungs to every cell in your body. Your cells need oxygen to grow, reproduce, and stay healthy. An RBC count that is higher or lower than normal is often the first sign of an illness. So the test may allow you to get treatment even before you have symptoms. People also call the RBC test in another names such as erythrocyte count, red count, or RBC. Let's discuss now WBC count. A white blood cell count measures the number of white blood cells in your blood. White blood cells are the part of immune system. They help your body fight off infection and other diseases. When you get sick, your body makes more white blood cells to fight the bacteria, viruses, or the other foreign substances which is causing your illness. This increases your white blood cell count. A white blood cells measure the total number of these cells in your blood. Another test called a blood differential measures the number of each type of white blood cells. There are 5 major types of white blood cell count, and you have seen in your reports of CBC, just like neutrophils, lymphocytes, monocytes, eosinophils, basophils. People also call this WBC test in another name, just like WBC count, white cell count, white blood cell count. Why do I need a red blood cell count? You may get this test as a part of a complete blood count, as we have already told about this, which is often included in routine checkup. You may also need this test if you have symptoms of low or high red blood cell count. Symptoms of low red blood cell count include below: weakness, fatigue, pale skin, rapid heartbeat, as well as symptoms of high red blood cell count include below: headache, dizziness, vision problems. Let's discuss now, why do I need white blood cell count? You may need this test if you have signs and symptoms of infection, inflammation, or the autoimmune diseases. Symptoms of infection include fever, chills, body aches, headache. Symptoms of inflammations and autoimmune diseases will be different depending on the area of the inflammation and the type of diseases. You may also need this test if you have a disease that weakens your immune system or are taking medicine that lower your immune response. If the test shows your white blood cells count is getting too low, your provider may be able to adjust your treatment. Newborn or the older child may also be tested as a part of routine screening. So if they have symptoms of white blood cell count disorder, so don't worry about all that. Consult your doctor about your WBC count as well as the RBC count. Now let's discuss what is RBC used for. A red blood cell count, RBC, is almost always part of a complete blood count, a group of tests that measure many different parts and features of your blood. The RBC measurement is used to help diagnose red blood cell disorders such as anemia, a condition in which your body does not make enough healthy red blood cells. Let's discuss, why is WBC used for? A white blood cell count is most often used to help diagnose disorder related to having a high white blood cells. I mean to say high white blood cell count or low white blood cell count. Disorders related to having a high white blood cell count include below: autoimmune and the inflammatory diseases, conditions that cause the immune system to attack healthy tissues, bacterial or the viral infection, cancer such as leukemia and the Hodgkin diseases, allergic reactions. Disorders related to having a low white blood cell count. If you have a low WBC count, you may need this test for this, and it is used for this diseases of immune system such as HIV, AIDS, lymphoma, a cancer of the bone marrow, diseases of the liver or spleen. A white blood cell count can show if the number of your white blood cells is too high or too low, but it can't confirm a diagnosis. So it is usually done along with the other tested such as complete blood count, blood differential blood smear, or the bone marrow test. Let's discuss now and come to the main point. What do the result mean of RBC? Your result will show whether you have a normal RBC count or too high or too low. So let's discuss it one by one. If you have a low red blood cell count, so it's a sign of anemia, leukemia, a type of blood cancer, malnutrition, a condition in which your body does not get the calories, vitamins, or the minerals needed for your good health. So this is the definition of malnutrition, you can say it. So multiple myeloma, a cancer of the bone marrow, kidney failure. It may also be a sign of pregnancy as well as. A high red blood cell count can be a sign of dehydration, heart disease, polycythemia vera, a bone marrow disease that cause too many red blood cells to be made. Scarring of the lungs, often due to the cigarettes smoking, lung disease, kidney disease, and the kidney cancer as well as also. And what do the WBC result mean? Let's discuss it. A high white blood cell count may mean you have one of the following condition. And what are the conditions? Here we go. Don't worry about all that. I'm here to help you. So a bacterial or the viral infection, an inflammatory diseases such as rheumatoid arthritis, an allergy, leukemia, or the Hodgkin diseases, tissues damage from a burn injury or surgery. A low white blood cell count may mean you have one of the following condition. And what are the condition? Here we go. Don't worry. I'm here to help you again. One of the following conditions given below: bone marrow damage. This may be caused by infection, disease, or the treatment such as chemotherapy. Cancer that affects the bone marrow, and autoimmune disorders such as lupus, HIV, AIDS. If you are already being treated for a white blood cell count disorder, your result may show if your treatment is working or whether your condition has improved or not. But still, if you have any kind of question regarding to your result, so consult your doctor. And if you have questions about your result, any kind of question, talk to your doctor. And if you are going to find how to maintain your WBC count, RBC count, so I am giving you some tips, okay? But these tips are valuable enough, but consult your doctor first. I'm not doctor, I'm just giving you tips, but tips are reliable and valuable for your health as well as your immune system. So this will increase your RBC count as well as if you are low red blood cell count, and these things will increase your immunity system if your white blood cell count are too low. So first, foods to boost RBC count or maintain RBC count. Leafy green vegetables eat, okay? Leaf green vegetables, nuts, mushrooms, or orange, okay? Meats and the copper, carrots, potatoes, fish, liver of the beef, and okay, liver of not human, liver of beef, okay? Leaf greeny vegetables, as I have already told. Vitamin A, take the vitamin A. Tomatoes, fruits full of vegetables first, and the vitamin C, almonds, pineapple, nuts. So as well as also take the vitamin E if you want to increase or maintain your red blood cell count. Now let's go for the white blood cell count, because white blood cell count are the most important for the immune system. So I will make another video for the immunity system, because this is a very big and the very most important topic. So I will make the video on the immunity system, how to boost. But here are some foods which will maintain your WBC count. Omega 3, fatty acids, green tea, you can take it. Garlic, fruits, vegetables, you can eat it. Special also think you can add papaya, nuts, seeds, vitamin B6, vitamin B12, folic acid, you can take, you can eat. Okay, thank you very much for watching our video.